The human and the work environment. Our bodies are made for physical activity. The human has not developed a lot, physically speaking, for the last 20,000 years. In order to stay healthy, human beings need variation in physical activity and alternate load during work and free time. Otherwise, they run the risk of developing illness due to heavy workload, such as joint and muscular diseases and stress diseases. This is important to keep in mind when creating workplaces and work tasks. When we are stressed, the number of heartbeats per minute increases since the body reacts to stress as a threat to our survival and prepares to be able to run away quickly or stay and fight. In other words, the same way our ancestors needed when living on the savannah, in the Stone Age, and in war times. Therefore, it's of great importance that human beings today do not live a too passive and sedentary life, but rather use physical activity to exhaust the stress hormones that increase with pulse and are released in the bloodstream in stressful situations. The physical and mental workload needs to be alternated and in appropriate extent. Otherwise, it will be hard to come to terms with diseases connected to heavy workload, joint and muscular diseases, as well as stress-related diseases in the work environment. What is work? Work is a human activity that generates financial gain through goods or services. But work can also be unpaid. Sometimes we count voluntary work, household work, and studies as unpaid work. Work usually gives us an income. However, there are other aspects of work. Work can be said to be very positive since it may provide meaningful activities, social inclusion, and sense of context. These are factors that are important to our well-being and health, both from a societal perspective and for the individual citizen. At the same time, work can expose us to risks. We can be affected by occupational illness or injury, which can lead to ill health and create suffering to individuals and their relatives, to the organization or enterprise, as well as to society. Is health really that important when discussing an organization or enterprise, when there are so many other things to pay attention to? Well, we will attempt to explain the relation between the concepts health and work. Occupational health is affected by external conditions and circumstances. For example, laws and regulations, such as work environment management. It's also affected by political decisions and by demand and world economy, as well as by societal changes, etc. These all have an impact on occupational health. However, occupational health is also affected by internal conditions and circumstances in the workplace. For example, through leadership and the mental work environment with demand and control. Through the ergonomics, physical design, and safety of the work environment. Employees' occupational health affects the organization or enterprise, since the execution of work tasks and their quality may depend on whether the employee experiences well-being at work. Sick leave and sickness benefits also affects the finances of the enterprise or organization. Employee and managers' occupational health affects the finances through costs for pension, occupational injury, and staff turnover. There are different arenas to promote health and well-being in working life and to prevent ill health. These can be divided into 9 different areas. These are self-rated health, diagnosis, illness, and function variations. It is the physical work environment with climate, tear, and injury. It is the mental work environment with demand and control. It is the working hours and the time for recuperation during and between work shifts. It is the personal financial situation, and it is the personal social situation with partner, family, and close friends, and how this affects working life. It is attitudes within the organization, through leadership, if there is discrimination present, and what the social inclusion and support is like. It is our work tasks, whether these are stimulating and offer self-fulfillment through work activities. It is competence, skills, and the possibility for competence development in work. An investigation was conducted by the Swedish government to examine whether a healthy work environment is a success factor. These quotes are collected from this investigation. For example, good health in working life equals good business at the bottom right in the organization's and the enterprise's bookkeeping. A good occupational health for employees can improve the organization's results through financial savings regarding sickness benefits, but also increased customer satisfaction and profitability. Skilled, motivated, and healthy employees usually perform to higher standard and want to stay in the organization for longer. Therefore, these are positive factors to be added to the fact that employees in the organization are healthy and experience well-being. The possibility of sound occupational health and profitability are connected. We will leave health for a moment and look closer at ill health. Systematic work environment management is used to prevent ill health. In the systematic work environment management, the definition of ill health is as follows. Ill health can mean both illness defined by medical objective criteria and physical and mental functional disturbances of various kinds, which are not illnesses in the objective sense. For example, different kinds of stress reactions or musculoskeletal disorders. Conditions of this kind can lead to illness. It is the intensity of the experiences, the duration, and the ability of the person concerned to function as before that decides whether ill health is present. In other words, the subjective experience of the individual is of great importance to determine whether ill health is present or not. Enterprises and organizations are to prevent what is described as ill health according to this definition. There are some concepts that are usually mentioned on the topic of occupational health and work environment. Work injury is an injury or illness caused by a work-related accident or other harmful impact from work. Some contagious diseases count as work injury. Work injury is, in other words, an umbrella term that covers both work-related illness and work-related accidents. But what does work-related accidents then mean? Well, work-related accidents may be physical or mental injury caused by a sudden event. Accidents may occur to human or technical errors, or by, for example, unforeseen reactions from animals. Cases of acute poisoning also count as work-related accidents, and accidents that happen during work hours but outside the workplace. Furthermore, traffic accidents that may occur during work counts as work-related accidents. Work-related illness, on the other hand, are work injuries that occur in other ways than through work-related accidents. Factors that may cause work-related illness are exposure to hazardous substances, exposure to radiation, one-sided or unusual movements and work postures, vibrations, noise, or infection. In other words, work-related illness is usually developed over a time period, whereas a work-related accident is caused by a sudden event. How does a work injury occur then? An accident is usually defined as a sudden, unintentional event that has harmful impact on people, environment, or property. Illness is usually defined as an ailment that has been developed over time. Furthermore, An incident is usually defined as an event or threatening situation that easily could have developed into an accident or illness, but thankfully did not. How do incidents, work-related injuries, and cases of death relate to each other? To describe this, the metaphor of the iceberg is usually used. For most icebergs, only the tip is visible above the water surface, while most of it remains invisible under the surface. Unfortunately, deaths do occur in working life, and these are the ones we usually hear about through news and newspapers and are horrified by. This is the part of the iceberg that is visible. But the larger part of the iceberg is invisible to us. In other words, for every case of death, several work-related injuries have occurred that may have caused individuals lifelong suffering and that may have caused organizations and enterprises loss of finances and of human competence. In order to examine the iceberg of occupational injury further, we find the incidents even deeper under the surface. For every work-related injury, statistically speaking, several incidents or threatening situations have occurred that could easily have developed into an injury. When working to prevent accidents and injuries, it is of great importance to start with decreasing the risks of incidents and situations where incidents may occur. Errare humanum est. To err is human. Well, it is. But if we think ahead, we may be able to prevent some risks of work injury. How we act in certain situations is based on knowledge-based behavior, rule-based behavior, or skill-based behavior. Skill-based behavior are routines we have learned and do without thinking. We react automatically, like an autopilot. For example, when riding a bicycle, this requires experience and exercise. Rule-based behavior are actions based on rules we have learned and that we have always followed. For example, we stop when we see a stop sign because we recognize the sign and it gives a clue on how to act, and we therefore act accordingly. The more often an individual follows rule-based behavior, the more skill-based behavior it becomes. Knowledge-based behavior is when we are presented with a new unknown situation, where there are no learned rules or skills that can guide us. We make a more conscious consideration of the problem and decision in these situations. There is a risk that we become blind to flaws we usually encounter in a work situation and workplace and execute most actions based on skill-based and rule-based behavior. There is no room for new routines and ways to work. One can develop tunnel vision, because this is the way we always have done it. Tunnel vision caused a nuclear accident at 3 Mile Island power plant in the US. An operator persisted for hours that there was a cooler water leak when certain lights signaled, and therefore shut the water off, when really it was the other way around, and this caused a meltdown. Therefore, it is important to continuously manage and reflect on risks and possible situations that may occur, what consequences they may bring, and what actions should be taken immediately and in the future in order to prevent or decrease possible risks. But also exercise rule-based behavior so that people know how to react when a risk is present. For example, in the case of a fire, or a risk of collapse, or a risk of a bull escaping from its pasture. Therefore, these different behaviors are worth using and reflecting on when trying to prevent risks in the workplace and work environment. That the sources of risk are identified, that the possible causes and consequences should be the starting points when planning and implementing preventive actions and measures. Consider and reflect. What significance does an individual's health and well-being have for their own activities? What significance does an individual's health have for the workplace, the organization, or enterprise where they are employed? Does health have equal or unequal significance to the organization or enterprise, depending on the occupation, position, or age of the individual? What significance does the citizen's health have for society?